All right, today we are diving into a really big topic, the U.S. healthcare system. It's a place that's on the cutting edge of medical breakthroughs, but at the same time, it's famous for being one of the most confusing and expensive systems in the world. So let's break it down, how it's built, what makes it tick, and why it's such a bundle of contradictions. And this right here really gets to the heart of it. It's a paradox, right? On one side, you have these incredible innovations. We're talking robotics, gene therapy, some of the best hospitals you can imagine. But on the other side, you've got these crushing costs and a structure that's just so complicated. Understanding that tension is really the key to getting a handle on the whole system, and that's exactly what we're going to do. Okay, so that's the big question, isn't it? How does a system with so many different moving parts actually function day to day? If you're a patient, what's that journey even look like? Well, to figure that out, we've got to look at how it's fundamentally built. So here's our game plan. We'll start by talking about the system's unique hybrid nature. Then, we're going to explore its three main pillars. After that, we'll get into the powerful role that technology plays. And finally, we'll weigh its biggest innovations against its toughest challenges. First things first, the key to understanding the U.S. system is knowing that it isn't just one single thing. It's what you'd call a hybrid. A lot of other developed countries have what's called a single-payer system, where the government is pretty much the main insurer for everybody. The U.S. is different. Think of it less like a straight, streamlined highway and more like a giant patchwork quilt. You've got private companies, plans from your job, and government programs all stitched together. And that unique mix, that's the number one reason it's so famously complex. So if this system is a complex patchwork, what are the main pieces that make it up? It really all comes down to three foundational pillars. And if you can grasp how these three interact, you can start to see the bigger picture. Basically, the whole operation rests on these three components working together or, sometimes not working so well together. You have the people who actually provide the care, the system that pays for it, and then the government safety nets. Let's take a look at each one. First up, you've got the providers. This pillar is probably the most straightforward. These are the actual doctors, the nurses, the hospitals, and the clinics, the people on the front lines delivering care. And in the U.S., most of these operate as private businesses or nonprofits, not as government agencies. Now for the second pillar, insurance. And this is where the U.S. system gets really unique. For most Americans, the path to seeing a doctor goes directly through an insurance company. And for the vast majority, that insurance is tied to their job. A system that actually started as a workplace perk back during World War II and just grew to become this defining feature of American life. The third pillar is the government. To fill in the gaps left by that private insurance market, the government runs two absolutely massive programs, Medicare and Medicaid. It's actually pretty simple to remember. Medicare is primarily for older adults, usually 65 and up, and Medicaid is for individuals and families who have low incomes. So, two different programs aimed at two very different groups of people. Okay, let's shift gears now to what is arguably the system's greatest strength, its constant, relentless drive for technological innovation. And this isn't just some nice add-on, it is woven into the very fabric of American healthcare. I mean, when we talk about technology, we're talking about tools that have become totally standard practice. Think about electronic health records, or EHRs, that finally got rid of all those paper charts. Or the incredible MRI and CT scanners that give doctors a look inside the human body like never before. And of course, more recently, the huge boom in telemedicine, which brings a doctor's visit right to your screen. And this quote right here, it nails a deeper point. Modern medicine is becoming a field of information science. It's not just about biology and chemistry anymore. It's about managing enormous amounts of data, making sure communication is secure, and using tiny little embedded sensors to track our health in real time. Wireless technology is a perfect example of this in action. It's the very thing that allows a patient with a heart condition to be monitored from their own home. It's the engine inside the smartwatch that tracks your vital signs. And it's what lets a doctor get critical, real-time data from a patient who's miles and miles away. It's literally untethering healthcare from the hospital. So, we have this innovative, incredibly high-tech system. But like we said right at the start, that innovation exists right alongside some pretty significant challenges. Let's put them side by side. This table really captures the system's split personality. On the left, you've got these undeniable strengths: world-class hospitals, groundbreaking research, a really dynamic private sector. But look over to the right, and you can see how each of those strengths casts a shadow. That amazing infrastructure? Well, it drives up costs. That dynamic private sector, it creates a maze of confusing insurance plans, which then leads to big differences in who can get care. They're really just two sides of the same coin. And at the end of the day, it's impossible to separate these pieces. The cutting-edge technology, the powerful private industry, and the complicated insurance structure, they aren't just features of the system, they are the system. They are all wound together in its DNA. So, if you're going to take away just 3 things from all this, let it be these. First, the system is a true hybrid, a mix of public and private that creates both incredible innovation and a lot of confusion. Second, for most people, insurance isn't just some side detail, it's the main gatekeeper to getting medical care. And third, technology isn't just improving the system, it's fundamentally shaping it into a field of data and information. So, in one sentence, what you have is this incredibly innovative, technology-driven framework that's built on a complex web of private medical services, insurance, and government safety nets. And all of this leaves us with a huge question for the future. As technology like AI and personal health sensors becomes even more powerful and central to our lives, how will this incredibly complex system adapt? Can it use all that innovation to finally solve its big challenges with cost and access? Well, that's the billion-dollar question, isn't it?